After nearly 25 years, Dr. Ira Zunin, the medical director of Manakai O Malama Integrative Healthcare Group and Rehabilitation Center, is retiring at the end of this month, and he's looking for someone to take over. Joining us to share more is Dr. Zunin. Thank you so much for joining us today.
Hello, good morning. Great to be here.
So can you tell us a little bit about why this center is so important to the community and what makes it different?
Well, the center is a big center. We've had typically up to 50 staff and have treated the better part of 1 million visits in the last quarter century. So it's been a big part of the community. But we've also practiced in a kind of a unique way where we're really looking at body, mind, spirit, and really treating patients as a whole person and in an effort to create a medical home, actually. And that's something we don't see too often.
You know, now that you have announced your retirement, which is going to be at the end of the month, what is the future of the center?
Well, the center may just close. There's still some people who are interested in looking at taking it over or taking over the facility. But it's a challenging place to run. So anybody who would probably take it over would make it their own. It can be just for primary care, but we have quite a few activity centers, from a sleep lab to behavioral health to injured workers. I mean, it's a lot of things going on there over the years.
You know, I want to ask, you have been in this field for decades now. You know, is the Hawaii healthcare system in crisis? As you know, two big companies, you know, are merging. There's HMSA and Hawaii Pacific Health. And so there are some industry leaders that are trying to look for solutions. What is your solution to this?
Well, there's two big companies that want to merge, but they do not yet have clearance to merge. Mm-hmm. And I will say that, first let me just say, we are very fortunate, you know, to have a governor who's a physician and really understands a lot about healthcare and has made every effort possible. But no one person can fix the level of crisis we're seeing now. And absolutely, yes, Hawaii has never been in this state of crisis for healthcare. We're very short on doctors. In the Big Island, as low as 58% short of doctors. So we don't have the healthcare providers. We're having problems with management with some of our largest carriers. Our largest insurance companies, our largest hospital groups, virtually all of them are losing money. And the federal government has pulled back on support for the Affordable Care Act, Obamacare. So now you have all of these people, 5 million this year are losing insurance in this country and tens of thousands in Hawaii. So now instead they're going to the emergency room, and these small hospitals, these emergency rooms are just overwhelmed with visits that really aren't necessary if there were doctors to be able to take care of these patients outside.
And, you know, adding on top of that, the other layer is AI now.
Yeah.
Right? That's like almost in every industry that we see in all these different fields. So how does the healthcare system kind of just navigate through that?
Well, it's a great question. AI is really starting to touch healthcare deeply, and it's a two-edged sword. So if you have somebody who grew up on TikTok and now is looking at AI, they have no basis, they have no background. So AI, you become AI's tool. What we need is people who have experience in medicine, who understand theory of science, who understand humanistic medicine and can use AI as a tool. If we can do that successfully, and I'm working on a big project with the University of Washington now, rolling out theirs. Hawaii Pacific Health is just starting to roll out a pilot. If we do it properly, it can help us save time, get to a diagnosis faster, and let us use our time and energy to bond with our patients, to explain, to have more time for the human side of care.
Well, Dr. Zunin, thank you very much for being here and your insight.